Las Vegas is amazing, and we believe in the power of community. Hi, I'm your host, Slone Terranella. Join us in our mission to make the city a better place for all. Together, we can create a brighter future for the Valley, which is why we're talking solutions. There are more than 7,000 rare diseases in the United States, affecting roughly 30 million people. Chances are you probably know somebody that's affected by one of these diseases: childhood cancer, some forms of adult cancer, cystic fibrosis, muscular dystrophy. I mean, I can keep going. And there's also a lot of other genetic disorders. But like I said, the list can go on. But currently in Nevada, we lack vital information on the number of families affected by rare diseases. But hopefully that's about to change. This month, the Nevada Rare Disease Advisory Council is asking the public to take part in the While You Wait campaign. This survey will help the state determine how many families are affected by rare diseases. Hopefully, this can help the state allocate the necessary resources, treatment options, and more for these families. With us today are two amazing guests: Annette Logan-Parker, who's the board chair of the Nevada Rare Disease Advisory Council, who is spearheading the While You Wait campaign, and Tiffany Ruben, who's the mother of five awesome children, four of whom are affected by a condition called Niemann-Pick disease. Thank you so much for joining us here today.
Thank you
Thank
for
you.
having us.
Yeah,
It's an
thank you.
honor.
Thank you. Thank you. So, the first question I have is for you, Annette. Can you help us understand a little better the While You Wait campaign and why it's so needed?
Sure. So the While You Wait campaign is an initiative spearheaded by the Nevada Rare Disease Advisory Council, and it's aimed at gathering crucial information regarding rare diseases in Nevada. The campaign itself seeks to engage individuals in a needs assessment style of a survey, and we're calling it the While You Wait campaign because we're putting posters and flyers in physician offices, urgent cares, emergency rooms, places where people normally have to wait. And so we thought that this style of a message would make good use of the time while they're waiting and help us, efficiently collect very valuable data. The primary objective of the campaign is to understand the prevalence and the scope of rare diseases within the state of Nevada. And by gathering comprehensive data throughout this needs assessment or survey, the RDAC, that's what we call ourselves, so the Nevada Rare Disease Advisory Council, we go by the RDAC. We really want to identify the extent of rare diseases affecting the population of Nevada specifically.
What a great effort. I mean, would you say too that there is a disconnect between rural populations and the data we have in our rural areas versus more of our like developed cities? Or would you say that all across the state we've had this issue of getting data?
Well, I think as it relates to rare diseases, the state itself has no data. There hasn't been an organized method or an organized fashion of collecting the data as it relates to rare diseases. I think the state of Nevada collects important data. We just haven't addressed this particular topic yet. And we're really hoping, I'm hoping as the chair of the RDAC, that the data will help us not only improve the quality of care through understanding the prevalence and specific needs related to rare diseases, but also help the healthcare providers tailor their services better. I'm hoping that it will help in developing specialized care plans and ensuring that individuals and families with rare diseases receive the appropriate and effective treatment that they need. And then it's also going to be used to advise state agencies and lawmakers. So the data will be collected and analyzed and presented to our governor and the leaders at the Department of Health and Human Services and all of our lawmakers. And I'm really hoping that by having concrete statistics and insights into the rare disease landscape in Nevada, we can help policymakers make informed decisions regarding research funding, healthcare policies, allocation of resources, and the development of support programs.
That is so amazing because it sounds like the RDAC really tackles multifaceted approach to how to help from a policy change, from a short term, for a long term solution. If you're not waiting at the doctors, though, can you get this needs assessment online? How else can people access this?
Oh, absolutely. So all of the posters and the flyers have a QR code that can be accessed through a smartphone or other QR code device, and it will guide you right through to the site. So you can access it through the traditional internet at the Nevada RDAC website, which is NVRDAC NVRDAC.org. But we're really hoping that the QR codes will be a helpful and efficient way to make it easy for people to participate. The QR code will take you right to the site, just like a menu at a restaurant. It'll give you instructions and it will share a little bit about why we're collecting the data. It will remind everybody that this is completely anonymous. We're not asking for personal information that can identify individuals or families. And so we're hoping that that will be an easy way, offering both avenues to access the survey.
And, I think this is almost like the census, right? Where you need to know how many people are affected or in this certain population of people to get funding, to get vital resources. But, Annette, who should be taking this survey to begin with?
So the survey itself focuses on two primary groups. First group is the individuals living with rare diseases. Caregivers, anybody who's involved with someone is encouraged to participate in the survey to share their experiences, their challenges, and the needs related to their rare disease. So this needs assessment is more than just who has a rare disease and how old are they and where do they live. This is really digging deeper into what was their experience with the diagnostic process? How long did it take to receive a definitive diagnosis? What was that like? So that we can use this data to help educate the healthcare providers and the insurance companies and everybody who's involved in, I call it shepherding, right? Shepherding the patients through the system. That's a challenging role to have in the healthcare delivery system. And we really have an opportunity to educate those folks on what these families and these individuals actually go through. It's a very, very challenging process. We even call it the diagnostic odyssey that is associated with getting a definitive diagnosis when you have a rare disease. And so we're really hoping that this information that families and caregivers, and this survey is open to people, even if the family member or person with the rare disease has already passed on. We would love to understand the experiences from beginning to end so that we can really help lawmakers understand how to bridge the gap between rare disease patients and the resources that are available to them, in contrast to the resources that really should be available to them.
Thank you for that. And, of course, talking about data is really important when it comes to rare diseases. But I do want to focus about the human aspect and the whole reason why we're really doing this in the first place. So, Tiffany, I would love for you to tell our listeners a little bit about Niemann-Pick disease type C. As we mentioned, you have 5 children, 4 of which are affected by this condition. And we should mention that one of your boys, Jacob, did pass away from this disease. So our condolences. I'm so sorry to hear that. I can't imagine what the family is going through, but can you help us paint a picture about what this looks like for your family?
Sure. Yeah, we were diagnosed in 2018. Jacob passed away in 2019 of Niemann-Pick. Niemann-Pick is a fatal genetic disease that they don't have an enzyme that recycles the cholesterol and lipids in their cells. So it causes blockages in their cells, and those blockages cause problems in their major organs. Our disease also has the nickname of children's Alzheimer's, which then cause neurodegenerative problems that mimic Alzheimer's, like the real disease. So that's what our disease is kind of like.
Wow.
And I think it's important to note that Niemann-Pick is very rare.
Super rare, very rare.
Yes, fewer than 1,000 people are diagnosed annually. It's considered extremely rare.
And
Very,
I can
very rare.
imagine because of how rare it is, the journey to even getting a diagnosis was an experience all in itself. So, did you have trouble getting the initial diagnosis, Tiffany?
Yes, so we were the only family here in Nevada for a long time, actually. There's only one other family that I know of in Nevada as of right now that actually even have it. Our son was 3 when we decided there was something wrong with him. Like, there was definitely something wrong. It took 3.5 really long, agonizing years. So when you talked about a diagnostic odyssey, that was definitely what it felt like. And as a parent who doesn't know the system, it is very challenging because you don't know insurance, you don't know doctors, and you are trying to advocate for your child. And when you're dealing with this disease, I know with our child, we were losing skills left and right. And so it was really frustrating. And you had these doctors that were telling telling you one thing, and you had this frustration of like your child is getting sicker and sicker. And so you're trying to advocate and you're trying to get second opinions and trying to work in the medical system. And so it was just like so frustrating. And I remember arguing with my insurance and trying to get second opinions and going behind my doctor's backs, trying to figure out like, how do I get, my doctor wants this thing, but it's not working for me, or like they wanted to wait longer. And so I remember we went to Salt Lake. They didn't give us good answers. We went to California. We went to California 5 different times. Our last time going to California, we ended up in a clinic and the doctor looked at us and said, I don't even know why you're in our clinic. And they ended up finding our diagnosis. So like we ended up getting that quite a few times where people didn't even know why we were in their clinic, but that's why we were referred there. So just that frustration of, you would give them, these are my child's symptoms, and then they would just refer you, and then you would just go to different people. So like that was really frustrating. And as a parent, it's really frustrating because you're just trying to like get your child seen and taken care of.
Yeah, I can imagine. It's emotional. It's also physically
Yes.
demanding, going from one
And
state to another.
expensive, super
Exactly.
expensive.
A revolving door of specialists.
Mhm.
So I'm so
Yeah.
glad that at least you got some sort of answer, and now we can work off of a diagnosis. There's no known cure yet,
No.
but there are treatments that do benefit patients that hasn't even picked. So how often are treatments required? And can this be a financial burden for families that deal with this?
So there are a few different experimental treatments going on right now. There's like a few different medicines. The one I'm most familiar with is the one that my sons are on. It's a spinal injection of an experimental medicine that they receive every 2 weeks, that we've been going on 6 years, that they've received this every other Friday for 6 years. They get a spinal injection of medicine. It's expensive. It's time consuming every 2 weeks. So it is a burden because you have to block out time. It's not fun for them. They get a spinal injection. My poor 8 and 6-year-old has had over 150 spinal injections of medicine, and my 4-year-old has had over 50. They're not enjoyable, and it's not a fun thing for them, but it has given me longer to have them on the earth. I'm grateful for them.
Truly a super family. I
Yeah.
mean, your babies have gone through so much as well as you. So I really support you guys for doing that. I mean, that not a lot of people can do what you do. And once again, I'm really sorry for your loss as well.
No, thanks.
But, Annette, a little back to this campaign. Is the While You Wait campaign a statewide effort?
It is a statewide effort. We are focusing on urban, north, south, and rural and frontier. It will be an interesting process to get out there and gather all this information. It's going to take a lot of people having big social media campaigns. It's so important for us to learn about the number of families that are affected by a rare disease. And the information that we want to gather from this survey will be utilized by the rare disease community in so many ways. The data will serve as compelling evidence to educate lawmakers about the impact that rare disease has on families, like Tiffany just explained that happens for her family. And by presenting concrete statistics and insights into these types of challenges, we are really, really hoping to help policymakers gain a much deeper understanding of the urgent need for support and resources within the rare disease community. Shaping public policy is something that it's going to take a groundswell effort, like the one that we're creating with the RDAC. And we're really hoping to turn over every rock in the state of Nevada where there might be information, so that we can really help align the public policy with the realities faced by the rare disease community. I think that it's not that people don't want to help. I think that they don't have a clear understanding of how to help. We're hoping that it will be a word of mouth type of groundswell campaign. I know that the rare disease community in and of itself does become a tight-knit group. So I'm really hoping to get help from families like Tiffany's and many others to get the word out. They themselves will complete the survey. It takes about 20 to 30 minutes. So it's a comprehensive data collection instrument. And I can tell you, it was interesting because a lot of people first told me people aren't going to take 20 to 30 minutes to fill it out. And I said, people with rare diseases will absolutely spend 20 to 30 minutes. They spend years and often a lifetime seeking diagnoses. So I am absolutely confident that people will definitely take the time required to give us the caliber of data that we need so that we can make a permanent and positive impact for the rare disease community in Nevada.
I had a good friend who suffered from mast cell activation syndrome, and she couldn't get a diagnosis for years as well. So it was funny. I was telling her about this campaign and she goes, "Oh my goodness, I'm definitely going to help out because my confusion, my journey, and the struggles I had. I mean, filling out a survey for 30 minutes is no problem versus honestly what felt like an eternity of waiting."
And look how many you can help by your data. Like you can help make a change so that other people can be helped.
Absolutely. You know, another benefit of this needs assessment is because the needs assessment will take people to the Rare Disease Advisory Council's website. That website has resources that they might not have known to look for, they might not know is even available. So I'm hoping that it's a twofold mission.
Oh,
One,
nice.
to gather the information, but to also expose the people who, you know, have rare diseases to a whole plethora of resources that they may or may not have known was available to them on the RDAC website.
Amazing. And once again, you can go to nvrdac.org for all the great information that Annette just said. I mean, and another thing that I think is amazing about RDAC that we did touch upon was that you guys, I mean, of course, the While You Wait campaign, but also you guys have evidence-based strategies to prevent and control rare diseases. You evaluate the systems for delivery of treatment for rare diseases. I mean, I think, and so much more. You guys just do so much more. But I mean, is there any other success stories or even future initiatives that you want to highlight?
Sure. So the Nevada RDAC is relatively new. There are currently, at this time, 27 rare disease advisory councils in the country. So Nevada, I think we were number 11 when we gained the status through the Nevada legislature. And we have a lot of lofty goals. Our strategic plan can also be located on the Nevada RDAC website. But you know, the RDAC in Nevada, well, really all RDACs are just kind of getting started. There is this nationwide initiative about rare diseases because it is so complicated. You know, people are becoming more vocal about what their needs are, how their needs are and are not being met. Insurance companies are recognizing that rare diseases are not only expensive, but often labor intense from an administrative perspective. So any information that we can provide to insurance companies so that they can navigate the utilization review and the complex case management process more efficiently will be amazing. You know, initially we want to gather the data and we want to analyze the data and then share the data. And then I'm hopeful that that will take us down a discovery path as a state on how we can do things more efficiently, how we can do things better. The sky's the limit for the RDAC. We do have a funding opportunity that I should share. You know, when you go to the Department of Motor Vehicles and you can choose license plates, you can choose the Childhood Cancer Awareness license plate. And the resources that are accumulated from that actually are the resources that support the Nevada RDAC's initiatives and activities. So that's an important thing for people to know as well.
Wow. I mean, it definitely sounds to me as well that this data will kind of make this kaleidoscope more into a looking glass where hopefully now we have like a base to work off. You know, Tiffany, being a parent, like I said, is hard enough, but also being a super mom to children can be just another layer to your parenting experience. But, you know, would you say that is there a community for parents who are dealing or who do have children with rare diseases, a community where you guys can come together and support each other?
You know what? I feel like in Las Vegas, I haven't really found a big support here. I feel like just listening to you talk, I'm excited to go look on that website and just find those extra little things so I can find more support systems, because I do feel like we're lacking those types of things. Sometimes in the rare disease, you do feel alone and like there's not a lot of people that have my disease, but even when you find somebody that has a rare disease, you feel this like instant connection with them because you know that they have something that's not common. Finding that would be very helpful.
Yeah.
Absolutely. Tiffany, what's
Yeah.
interesting about rare diseases is regardless of which type of rare disease a family is diagnosed with, the challenges are so similar.
Very
for every
similar.
rare disease.
Yeah.
The challenges are similar, the emotional impact on the family and the siblings and the whole thing. It's almost like maybe a different diagnosis code, but it really is the same story.
Yeah.
And so finding ways to connect people. But one of the things that we're doing over at Cure for the Kids Foundation is we're starting a rare disease parent advisory committee to address those very
awesome.
specific things, Tiffany. I do believe that we can make a significant impact based on what we've been able to accomplish over at Cure for the Kids. I feel like anything is possible, and we just need to get the right people together and stimulate the right kinds of conversations and keep talking until we can start to see the improvement that these children, our children, and our families deserve.
That would be such an amazing community. I feel like, especially like you said, I mean, dealing with a chronic condition, a rare disease, that can be very isolating, especially whether you're the caretaker, the child, the person dealing with it, can be an isolating experience. I mean, is there, Tiffany, or even Annette, is there any advice you have for parents that are dealing with this situation, or just having maybe themselves or their child are dealing with a rare disease?
My advice is advocate for yourself. Advocate for your family. If you don't feel like you're getting the information that you need, keep asking until you get the information or you're pointed in the right direction. Without parents, moms particularly, who are absolutely not willing to take no for an answer, are the ones that are making a difference in the rare disease communities.
That's so true. That, and then I think having somebody so if you have friends that are also rare disease moms, when you talk to them and find out how did you do that, they can give you suggestions on this is how I did it. So then you can go and do the same thing. That helped me so much. So I could go and say, well, this person's insurance did this. Can you do this? Or can I do this with my insurance? And so I could get pointers, because if I had to do it myself, I wouldn't know what questions to ask. But if I could ask somebody else, then I could ask at least some questions. And I asked a lot of stupid questions. I know at the beginning I had to, but that helped me a lot to do that, because it's a hard world. That medical world is hard, especially when you are by yourself. It's really hard, but not taking no for an answer. And then if it doesn't feel right, just keep going, even though it's really hard.
Absolutely. And as a career healthcare professional, there's no such thing as a dumb question, and all questions are important. And I think that is something that we also need to empower parents to understand and recognize, that it doesn't matter how many questions you have, and it doesn't matter how informed you are as you articulate your questions. They are all critically important, because I can tell you, no one knows the child better than their parents.
Wow.
And the information is there with mom. I know if we can just help moms and dads, it's a family affair. I get that. But it's been my experience that the moms are the primary caregivers in the rare disease world. And I think a big part of helping children with rare diseases is empowering moms who are navigating the rare disease world the best that we possibly can.
Yes. Well, very amazing. Thank you so much, ladies. I mean, through initiatives like this campaign, we have the opportunity to not only gather data, but also foster a sense of community and solidarity among families affected by rare diseases. Once again, we're here with Annette Logan-Parker, who's the board chair of the Nevada Rare Disease Advisory Council, who's spearheading the While You Wait campaign, and Tiffany Ruben, who's the mother of 5 awesome, amazing children, 4 of whom are affected by a condition called Niemann-Pick disease. Thank you so much, ladies, for joining us today on this amazing Sunday. Thank you, thank you, thank you.
You're welcome. Thank you again.
Thank you. We appreciate your interest in our campaign, and we thank you for helping us get the word out.
Thank you so much for listening. Talking Solutions is a production of Beasley Media Group. For topics, people, or stories that you think we should discuss, please email talkingsolutionsbmg@gmail.com.